Hello there, this is Dr. Argenal from Argenal Pediatrics. Today I want to talk to you about prenatal consultations. A prenatal consultation is recommended by the American Academy of Pediatrics for women that are pregnant, usually in their third trimester, in order to go out and meet with several pediatricians and find the one that is the best match for you. There are several issues that are typically discussed in a prenatal consultation. The ones that I think are most important is to, first of all, go see the building, go see the office, see if it's clean, see if the arrangement seems to be agreeable to you, if they have a breastfeeding room if you're planning to breastfeed, if they have separate areas for well childs and sick childs. Also, look at the staff, see how happy they look, how helpful they look. See what the environment is going to be like because you're going to be in that office quite often for well checkups. And unfortunately, if your child gets sick, you're also going to have to go. So you want to know those things. Then hopefully you get a chance to meet with a pediatrician that is going to be taking care of your child. When you meet with him or her, make sure you ask several important things. Whatever is mostly important to you, you want to take a moment to ask the questions. The ones that I find most important to discuss is what's the availability of the doctor? After hours, how does it work? Do you have to call an answering service? Do you call a cell phone? Is the doctor available? Is it one of his assistants? Is it an answering service? Those are important things. The other question that I typically appreciate patients asking me is what I think about breastfeeding. How can I help, or how will I help them accomplish breastfeeding if that's what they want to do? The other thing is, what is the practice philosophy on vaccines? Does the practice enforce vaccinations for all patients? Do they accept patients that don't vaccinate and unfortunately may carry a higher risk of transmitting diseases? Those things are important. Something else that not enough patients ask me, but I would love to discuss with them, is what the philosophy of that pediatrician is in regards to treatment of illnesses. Do they prescribe antibiotics for very select patients? Do they have a more liberal approach to antibiotics? What do they think about supplemental medications or homeopathic medications? Just get to know basically what your doctor's philosophy in medicine is, and see if that's the type of doctor that you would trust and you want to be in a relationship with, so long as your child is needing a pediatrician. I think that a prenatal consultation is the first step to building a good, solid relationship with your doctor. I really encourage you to come to Argenal Pediatrics or go to anybody else and get to know them, get to see what their beliefs are, what the environment is, how available are they going to be, how involved they want to be with your child. Good luck.